Hi, good day everyone. My name is Wong Chi-Han. Today I'll be talking about keratitis. Keratitis is an inflammation of the cornea, the clear dome-shaped tissue in front of the eye that covers pupil and iris. Keratitis may or may not be associated with an infection and non-infection. Keratitis can be caused by a relatively minor injury by wearing your contact lenses for too long or by a foreign body in the eye. Infectious keratitis can be caused by bacteria, viruses, fungi, and parasites.
This observational close-sectional study evaluated 100 consecutive patients seen at cornea clinic of the 2nd Xiangyang Hospital of Central Sound University, China. Causes of infections keratitis were diagnosed clinically. Fungal and ectoamoeba keratitis were confirmed by confocal microscopy. In 100 patients, 60 patients have non-infected cornea disease. Most commonly dry eye symptoms is 26.7%, followed by cornea abrasions is 18.3%, and non-infections keratitis is 8%. Of the patients with infections keratitis, viral keratitis was the most frequent case, which is 57.8%, followed by fungal 20%, bacteria 20%, and ectoamoeba 2.2%. Results demonstrate that rural diagnosis of infections keratitis, particularly bacteria and fungal keratitis. This may be because rural residents are exposed to more organic matter on a daily basis than urban residents. They are made to more predisposed to ocular trauma due to rural. However, we found another data were collected and reviewed from medical record of all patients with infections keratitis in Sipu Hospital from January 2013 up to May 2018. A total of 139 patients were included in this study. The average age of affected individual was 47.39 years. The most frequently affected patients fell in the age group of 20 to 30 years, with 61.5% of patients being male and 38.5% being female. 74 cases were not to have predisposer factor before the manifestations of symptoms. The commonest predisposer factor were ocular trauma, is 55.4%, followed by contact lens wear is 29.7%. Recent ocular surgery is 13.5%, and a recent history of swimming is 7.4%. Ocular injection was identified as the primary risk factor for infective keratitis in this study. Infective keratitis is caused by inflammations of the cornea from an injection pathogen that usually result in cornea scarring. It's a major cause of visual impairment globally. The management of infections keratitis is challenging. Thank you.
Hi guys, today my presentation is etiology of keratitis. Now we look about infection keratitis. Infection keratitis got a few types. There is bacterial infection. So bacteria can cause bacterial keratitis. Virus infection. The virus can lead to virus keratitis. This infection may be recurrent and are often associated with conditions like cold sores. And next is fungi infection. When fungi come into contact with the cornea, especially if the lens are worn for extended period or not properly cleaned, that can cause infection keratitis. And the next one is parasitic infection. Parasitic infection is relatively rare compared to other causes of keratitis, but it can be serious and may result in vision impairment if not properly diagnosed and treated. So guys, we can look at the following picture of different infection keratitis. After infection keratitis, now we talk about in ordinary life what situation can make us infected keratitis. The scratches or injury to the cornea can lead to non-infection keratitis. If microorganisms enter the damaged cornea, it can result in infection keratitis. Okay, next is microorganisms on contact lens. The bacteria, fungi, parasite, or virus can reside on the surface of contact lens or their case. When the lens is in the eyes, the cornea may get contaminated, causing infection keratitis. Poor contact lens hygiene or overuse can contribute to both infection and non-infection keratitis. And next is contaminated water. Water in ocean, river, lakes, or hot tub may contain bacteria, fungi, and parasites. If the eyes are exposed to these organisms during activity like swimming, keratitis can occur. However, a healthy cornea is less likely to become infected unless there is a pure breakdown of the corneal surface, for example from prolonged contact lens wear. And the last, poor hygiene practice, whether related to contact lens care or general hygiene, increase the risk of keratitis. The failure to follow proper cleaning procedures or using expired solution for contact lens can be contributing factor. So reminder, daily hygiene is the key to preventing keratitis. Thank you very much.
Hi, my name is Yun Nong Jun. Today my presentation is talk about the assessment of keratitis. The assessment of keratitis typically involve a thorough eye examination by a healthcare professional, such as optometrists and ophthalmologists. This may include history taking. The doctor will inquire about your symptoms, any recent injuries of infection, and your overall health. When taking a history for assessing keratitis, healthcare professionals typically inquire about various aspects to get the relevant information. This may include like onset of symptoms, predisposing factors, medical history, contact lens use, recent illness, previous treatment, and any symptoms. And the next is visual acuity test. This to assess the clarity of your vision. And the next is preliminary test. The ophthalmologist may examine your eye using a pen light to check your pupils, reaction, size, and other reaction. Another is slit lamp examination. This allows a detailed view of the cornea, where the doctor can identify any abnormalities, inflammation, or signs of infection. And the next is fluorescent staining. This involves using a special dye to highlight any defects or damage on the surface of the cornea. And the last is culture or scrapings. This, if infection is suspected, a sample may be taken for laboratory analysis to determine the type of microorganisms causing the keratitis. During an eye examination for keratitis, ophthalmologists will closely inspect the eyes to identify specific clinical signs indicative of corneal inflammation and document them with carefully in the clinical notes. This will be helpful when considering whether the eye is responding to treatment. This is the key clinical signs include, you can look at the figure 1, eyelid abnormalities such as trichiasis and leg ophthalmos. And figure 2 is reduced corneal sensation. And figure 3 is conjunctiva, inflammation, and discharge. Another is corneal edema. And the next is capillary concussion. And the last is hypoion. Once the assessment is complete, the doctor can determine the underlying cause and prescribe appropriate treatment. It's essential to seek prompt medical attention if you suspect keratitis to prevent potential complication and ensure effective management. That's all for my presentation today. Thank you.
Hi, let's talk about title diagnosis keratitis. For the eye exam to check your vision and eye pressure and look for a foreign object or any tears in your cornea. Slit lens. It provides a bright source of light and magnification to detect the character and extent of keratitis. Pen light exam to check your eye pupils reaction, size, and other factors. A stain may be applied to surface of your eyes. Used with the light, this stain makes it easier to see damage to the surface of the cornea. Laboratory analysis. Your eye care provider may take a sample of tear or some cells from your cornea for laboratory analysis to determine the cause of keratitis and to help develop a treatment plan for you. Clinical diagnosis. Diagnosis by clinical examination with history and physical exam. If you notice any sign or symptom of keratitis, make an appointment with your eye doctor. Delay in diagnosis and treatment of keratitis can lead to serious complications including blindness.
Hi, my name is Julia Chan. Today, let's explore the world of managing keratitis, a condition that needs careful attention and specific strategy for effective recovery. We will break down the approach into three parts: medical treatment, pain management, and cornea transplant. Firstly, the medical treatment. Think of the antibiotic eye drop is our frontliner heroes. They are like a specialized team fighting off specific bacteria. Moving on to antiviral medication. Sometimes oral antiviral join the team for a comprehensive attack. Now, antifungal eye drop as our precision tools. They are selected after identifying the enemy and due to the persistent nature for fungal infection. A prolonged strategy where diligence follow-up is crucial. For pain management, in the realm of discomfort, analgesics, non-steroid anti-inflammatory drugs step in to reduce pain and inflammation. For severe case, prescription option provide stronger relief under close supervision, and for immediate comfort during specific procedure, topical anesthetic come into play of caution, limited use. In extreme case, when irreparable damage impair vision, we consider a cornea transplant if necessary. It's like a vision rehabilitation project, replacing the damaged part with a carefully matched donor cornea. Post-transplant, we use immunosuppressive medication to prevent rejection, with regular checkup to catch and address any complication. It's important to note that this prescription should always involve an optometrist. Each patient is unique. For personalized guidance, ensure that most effective and safe recovery. Now talking about conclusion of keratitis, and I've got a few key points to share. Firstly, early detection is crucial, and treatment taking, like using specific medicine for specific problem. Comprehensive care is essential. However, prevention is a big deal too. Simple steps like eye protection and good hygiene lower the chance to get keratitis. Healthcare provider teams up and create plans that suit every person. Spreading the word is powerful by talking about the risks and how to prevent them. We empower everyone to take care of their eyes. In a nutshell, managing keratitis is about catching issue early, using the right treatment, taking comprehensive care, preventing problems, working together, and spreading the word. Let's keep our eyes healthy and clear. Thank you.